Hi, my name is Corey, and today I'll be demonstrating on how to do a proper ear examination. I'll be walking you through the steps on how to use an otoscope, which is a diagnostic tool to perform an ear exam. First, you want to make sure that you have your gloves, your alcohol wipes, and your otoscope kit. Within the otoscope kit, it's very good for ATs to use because it can be used to examine the ear, eyes, and mouth. Prior to doing this video, I made sure that the otoscope had batteries in it, and it is working, but I just want to show you where to place new batteries, which is underneath this cap. And these little guys right here are called speculums. Speculums are used to look into the patient's ear. You want to make sure that they fit snugly, but not too tight, but you do not want them to be loose. Before you do anything, it's always good for your own personal use to put gloves on. I'm going to take a sterile alcohol wipe. I'm going to wipe off the speculum here. I'm going to go over to my patient. Just to make sure that this one fits properly, you want to grab the pinna and not put it directly into the ear canal, but close to it. How's that feel?
Good.
Does it fit too loose?
That's fine.
Perfect. Come back over here. The patient said that this worked perfectly. Gonna wipe this off again here. Wipe off the tool. I'm gonna make sure that it fits snugly in here to tighten it up. Now, before you start, you wanna hit this red light right here, and you wanna make sure that the light is working to ensure that you can see everything within the ear. We're going to come over here. I'm going to ask my patient to please take a seat. I'm going to have the patient look down and towards me to kind of have the ear slightly towards so if there's any fluid within there. Before I go into the ear, it's important to ask the patient whatever ear hurts. So if it's her left ear that hurts, you want to do the right ear. You always want to do the good ear first, and then you can compare. You always want to compare bilaterally. Before I insert, you want to check to make sure there's no scars, no swelling on the outside, no redness. You want to make sure that the light is on. And when we go into the ear, you want to make sure that you're looking for a few things. You want to look for the tympanic membrane. It should be a gray or a white color. You're not looking for any fluid, because if fluid was in there, that would be considered like an infection. And you want to make sure they have some earwax, but not a lot. And you're just looking for the overall structures of the ear. So you want to have the patient's head down, slightly tilted. Grab the pinna. Do not place the speculum all the way into the ear canal, but partly in there. And you want to look around to see if you see anything abnormal. Everything looks good. But like I said, you want to check bilaterally. So I have the patient once again point their head down and look towards me. Grab the pinna. Also, you can do what we call is a hammer grip or a pencil grip. But as of what I'm going to do, I'm going to do a hammer grip. Place it into the canal and look. And she did say that this ear did hurt, and it looks a little bit irritated and red. When you're done, turn off the light. Come back over. You want to unloosen the speculum here. Take a proper alcohol wipe. It's important to clean up after you're done. Place it back into the kit. Close the kit properly here. And then when you're done, you want to properly dispose of your gloves and your alcohol wipes and waste paper basket. For some reason, if you had any type of blood or pus or anything, you would want to dispose of your gloves into a biohazard bin. And that's how you perform the proper steps for an ear exam. Thank you.